video, we're going to talk about how to feed a sleepy baby. Now, lots of our babies are quite sleepy after birth, especially for the first couple of weeks. So it's important that we wake our baby up for feeding, especially if our baby is born before term. We know that preterm babies are very sleepy, but so are near-term babies. So these are babies that are born maybe 36, 37 weeks. They do have a tendency to have a little bit more jaundice as well, which will make them sleepy. Now, many babies do get jaundice because they're born with a very high number of red blood cells, and they don't need these red blood cells after they're born. So the liver starts to break them down, and then they produce bilirubin. And this is what's going to make maybe the color of your baby's face, or the color of your baby's chest, or maybe you'll notice that whites of the baby's eyes are getting more and more yellow. If this is the case, it's very important to take your baby back to the hospital where you gave birth to your baby so that the nurse can do a bilirubin test. And occasionally your baby might need some phototherapy treatment. The best way to treat jaundice and prevent jaundice is to give the baby more breast milk, because it's the protein in your milk that's going to attach to the jaundice, and then it's going to get excreted in the urine and the stools. So the best thing we need to do in order to make sure that our baby's getting lots of milk at the breast, we want to again make sure that we've got the best latch possible, and when our baby's on the breast, we want to maybe make sure that we take off, if our baby has a hat on, we would want to take that off. We'd want to maybe stimulate the baby at the breast, and we'd want to make sure that we haven't got any clothes on our baby. So you can see our baby's really down to only his diaper and his little socks here. So when he's on the breast, we really want to just keep him nice and stimulated, talk to him, tell him that it's time for feeding and not time for sleeping. And if we find that the baby is pausing a lot and the baby isn't swallowing very much, then what we can do is we can switch feed, which means we can change breasts often. But the other thing that is a very useful technique to know as well is when your baby is latched on at the breast, if your baby starts to just suck quickly, then what we can do, we can put our hand around the breast like this, and we can just do a breast compression. So that would be, we would just go 1, 2, 3, 4, 5, and the nipple would obviously be in the baby's mouth, so we wouldn't want to be pulling the nipple out of the baby's mouth. And as we do this breast compression like this and just hold it for the count of 5, this is going to cause a milk ejection reflex, which is going to cause the baby to swallow the milk. And this will give the baby a little bit of a reminder that he's there for drinking and not sleeping. If your baby's very sleepy and you're concerned that your baby isn't waking up, obviously it's very important to see a doctor, but the best way sometimes we can wake our baby up, or we can actually do it at the end of the feed too, is to express a little bit of milk with our hand. So if we were expressing our breast, we'd want to just massage our breast around, and we're just going to press around the areola here, and we can just use a little cup like this, or maybe a little spoon, and we can express a little bit of our milk. And in fact, actually, it's the best way to express colostrum if you're expressing your first milk. It's the best way to do it, just by hand. And then once we've got our colostrum here, what we can do, we can just sit our baby up very gently, and we can just give our baby a little bit of support with the hand. And then what we would do is we just put the cup to the baby's lips, and we just lift the cup up until the colostrum or the milk touches the baby's tongue. And then what our baby would do is our baby would have a reflex to stick his tongue out and lap up the lap up the colostrum. And sometimes we can do this before a feed to wake our baby up, or we can do it after the feed to make sure our baby is getting enough, especially when they're very sleepy. So for more details about expressing and saving your milk, we have another video coming along. And remember, it's only newborn babies that are sleepy at the breast, so don't get discouraged. Keep going. Things are going to get easier.